society tries to push aside under the rug and pretend they don't see. So yes, I'm very excited we're going to have, yes, an interesting conversation.
She brought something out, like, so clearly. She said, we pretend we don't see.
Yeah, that's actually typical. And the other thing, if you combine her and me, you get Down syndrome colors.
So educate us on that. so Down syndrome colors are
yellow and blue. Yes, that's T21 chromosome defect.
Okay, now we've just started the conversation. Number one, I want to start by appreciating that it's World Health Day.
Yes.
And like I said earlier, every time people hear health, it's diabetes, it's cancer, it's HIV. But now we're bringing down to, you know what, let's pretend we don't see.
Yeah.
When you started championing, I want to understand the inspiration behind it.
Yes. Okay. So I am a mother of 3 boys. And 2 of my boys are on the autism spectrum with a comorbid of epilepsy and learning difficulties. So walking that journey as a parent, the stigma that comes through watching your children being rejected by society, also the tension that it brings in family, and yeah, you find 80% of us are single parents, and having to just navigate the system, especially the health system and social protection and education. It's one thing that can kill you before you even live, yet you need to live for that child because most of them are nonverbal. So if you don't stand up for them and speak on their behalf, then it's a disservice because no one else will. And like you say, people would like to just ignore, like, that one, no, I don't want to know, I don't care. You see, so you're left in this island alone, in a place where you have no idea where to go. Most of us parents, that's the first time you ever hear of the word either epilepsy or the word autism, and you're trying to just figure out what on earth is this. And it throws you into this space of depression, rejection. You face so much. And the inspiration behind it was, I look at it like a calling, because for me, I was just curious, because, you know, when having 2, it wasn't making sense why I have 2, so I kept questioning God, like, why would you do this to me? Like, what did I do to you? And that's the answer I got. Proverbs 31, 8 and 9. Speak on behalf of those who cannot speak for themselves and seek justice for those who are afflicted. And that's exactly what I am doing, following my purpose.
And I appreciate that you said seek justice.
Yes.
And speak for the voiceless.
Yes.
We're coming to that even way deeper on what she has been able to do so far, what she's working on, and of the social aspect. I think that's going to be more on, you know, on your side, because there's so many parents watching this morning who do not know what to do, how to handle the situation. But Doc, I also want to hear from you. Which are these neurodevelopmental disorders we're looking at? I'm not really sure from where I sit if I should call them disorders, disabilities, conditions, and that's the confusion the common man has, even just like I do. So you want to break down some of these. She's mentioned Down syndrome, autism. You just break some of them down for us.
Okay, so probably maybe we can just start by what is neurodevelopmental disorder. So as the name just suggests it, just to make it very simple, neuro is anything pertaining the brain. Developmental, as we know, is development, growth, yes. So basically these are conditions or disorders that affect the brain in its developmental stage. So a lot of these conditions are things that happen in childhood. Rarely would we have some being diagnosed in adulthood, but probably because they escaped diagnosis in childhood. But most of neurodevelopmental disorders are disorders of that begin in childhood. So some of them are, as we mentioned, the autism spectrum. And by spectrum, we say that because there are people who may express some autistic traits but not really meet the full criteria for autism. Other disorders, like the other one that you mentioned, Down syndrome, that comes under the genetic, the umbrella of the genetic abnormalities. We have Down syndrome, we have others, Fragile X, but complex names. But yeah, basically there's a problem with the genetic
makeup?
Gene. There's a gene that has
composition of it.
Yes, there's a gene that went not so well that during
not as normal.
Yes,
yes,
during the development of the baby. Most of these are pregnancy mostly, and
Alright.
familial. So you find most of the time with the genetic ones, as the name suggests, genes. Some will be just a genetic defect, some will be inherited genes. Yeah, so there's that. There's also other neurodevelopmental disorders such as ADHD, which is also very, very common. We also have learning disorders, which can come in very many different ways, difficulties in reading, difficulties in writing. We also have children who have what we call intellectual disability, previously known as mental retardation, but that term was a bit
Yes, the word
stigmatizing.
Yeah,
Calling someone
it's an
retarded.
insult.
Yes, or now known as intellectual disability. That's basically children who have, children to adults anyway, who have what's called below average IQ. Yeah.
Below average IQ.
Yes.
And I know there's a lot more that you might not be able to list, you know, this morning, but we'll be touching on each of those possibly. I want to hear a bit of your story, Sylvia, because I know there's a problem, like she said, some could exhibit, you know, traits, but are not really, you know, suffering that particular condition. How did you know that your sons were autistic? What were the signs and symptoms you could pick so that parents can also follow closely with you?
Okay, so first, let's start with the definition of autism.
Yes.
So you'll find it's a condition which is characterized by persistent and ongoing challenges in behavior, social, and you'll find that children will have repetitive behaviors. The developmental growth patterns will not be as expected, because you see, the same way you expect your child's neck to be stable for them to start talking and walking by a certain age. So those are the first things that you see. But in my story, like for my second born, who's the first one on the spectrum, the first thing was, okay, the neck control. But you see, at that time, you're a mother, you're so engrossed. We were having so many gastro issues with the stomach. And you know, those ones you're always told, oh, grip water. Colleagues, you know, those small things, and you ignore. But this, when it is so much, because he had reflux and sensitivity, like you see when you take our babies and they're knocked on the knee, that reaction, apparently it was so high. So there is now that time you're just like, what is that again? You have no idea. It didn't make sense to me at the time. So, you know, I'm being told, oh, he's lactose intolerant, you have to stop taking milk, you know.
That's
so
infancy stage.
Yeah, that is, we're talking about the very first few months. By the time he was 3, he started shaking. I asked, they said, oh, it's a habit, it might go away. Then when he was 6 months, he got a full-blown convulsion. So the way he had started crawling, started making sounds, all that disappeared. And I was like, okay, what is going on? Then after a while, like when he was 3, then that's when we noticed he's not talking at all. Everything he forgot, like crawling, whatever, he wasn't doing it. But he could sit at least, he could stand, he could do those. But then all these others were not just coming. And then also like social, he would just sit there, he's fine. Like you leave him, he's fine by himself. And by the time he was 2, he had a sibling. And so they were very close.
Yeah.
And that's when now I was like, okay, something is not right. And the doctor told me, I think you need to go for diagnosis. First of all, you're like, why? No one, that's the other thing. No one tells you, they just tell you, go to this doctor. I think you need to see this doctor.
Yes.
I think something. So the other thing, when I was having conversation with doctors, I was like, just tell us, like, expect this when you see this, it suggests this, but then do it slowly and calmly. Because you drop a word like, oh, I think your son is autistic. I wouldn't hear anything else you tell me after that, because first I'm trying to figure out, what did you just say? Then I pick my Google, and trust you me, when you read Google responses, you will die. Because
I saw the
you saw that expression. Yeah, trust you me, you see things and you're like, my child will not go anywhere. Because you see, it, like you said, it's a spectrum. We have mild, we have severe autism, we have just in between. Because like if you look at maybe A and B, they're like, you know, Northeast and Mombasa, you know, so different. And you see, the thing is, when you meet one child, like she said, there is characteristics. Not all of them are the same, because it's an entire. So will you be affected sensory-wise? Will it be the social skills? Will it be the cognitive skills? Is it your fine motor skills? Is it, there are those who don't have speech. There are those who get speech at 5, 10, some never, you know. So those are just the indicators that you will find. And difficulties, high pain threshold. excuse me, high pain threshold. Like, remember there's a day my son got banged, you know, the retracting doors. He was there like for 3 seconds. He didn't feel nothing. By the time he just did ouch, I'm like, holy smokes. You know the pain that for you will cry as an adult. He did not feel anything. While the other one is fearless. You know, he's not aware of his environment.
Yes.
He's been knocked by a car. He's fallen from first floor. December, he fell into a pool. And I'm just like, oh, God. So you always have to be there. Just watch out for this small thing. But it's not all doom and gloom. You'll find the mathematicians, musicians,
The
all of
geniuses.
that. Yes. So but the thing is, the difference is for us as parents, we have to be keen enough to identify those things. So you have to really pay attention.
Yeah.
For you to be able to spot them. And then at least for me, what I say for our nurses, when we are coming,
Yes.
and you know the way you go to clinic for this long, the minute you spot it, at least have that conversation. Like, we're behind here. Because you're given a graph. You know,
And I'm glad Doc is here,
you know,
hearing
you're
what
given
they do.
So those are the small things that we're just urging so that we can at least have early intervention where we know that, okay, something is wrong. What do we do about it in good time? Remember, she said you'll find adults who've not been diagnosed because no one actually took the time to identify these challenges. And for me, sometimes when I look at the adult autism that I know, I'm just trying to figure out, like, how did you live your life through it?
And we're going to come to how do you live your life through
Through
it,
it, yes.
With a present parent, because there are children without present parents,
Yes.
as we're speaking, and maybe we're going to come to that again. And she's mentioned something very important, like no one told her, you know, in the initial stages, even infancy, you know, and I want to hear from you, Doc, the diagnosis. You know, what are we looking at? And the signs, because hers started so early. There's some you see at what age? I know it's so vast, but just walk us through for the sake of that parent watching back at home.
Okay, so autism it's a very complex disorder. And again, there's a spectrum, as we said.
Yes.
Basically, when it comes to diagnosis, as she said, sometimes a child will present with some symptoms. You don't want to quickly go in and start throwing big words to the parent. You give it a bit of some time until you see whether the child meets what we call the criteria. In medicine, we have a lot of things to do with criteria. Do you meet the criteria? Do you fulfill the criteria to meet the diagnosis for that disorder? So we usually have the social interactions. There's impairment that you'll find this is a child who plays alone and they're very comfortable just being by themselves. You'll find this is a child who is the least bothered. You'll be seated there, you know how a child will be coming to you, Mom, here's a cup, or they want to show you this, or they want to show you that. Them, they're okay by the corner with their toys. I mean, life is good.
In their own world.
Yeah, life is good. Then the other thing is we have the repetitive behaviors. So you'll find they have sort of things they like doing over and over and over and over. See, for children, they want to do this, they touch here, they're bored of that, they go to the next thing. But with children with autism, they'll find that same behavior. You'll find them doing the same things over and over. For some kids, maybe if they have toy cars, they'll be arranging them the exact same line along the stairs, the exact same way from morning. It will be the exact same way. And then also with the repetitive behaviors comes the thing to do with routine. If you change the routine of an autistic kid, you have messed their day completely. So they have to follow routine. Yeah.
120%.
The minute you disrupt that routine, because you've really disoriented them. That's a very big point. The other thing is the language. When it comes to now the language development, you'll find most kids by around 6 months will have started babbling. Baba, mama, dada, you know, things like that. For some children, again, depends on their severity. For some, they may not get that babbling. So those could be the first signs that, how comes my child is not babbling 6 months? By the time they're 2 years, they should be able to make a few sentences which you can understand as a parent. You as an outsider may not be understanding what they're saying, but as a parent, you can try and figure out what they are asking for.
Yes.
For children with autism, the speech usually delayed, quite delayed, and for some does not develop. So actually a lot of times that is what pushes parents to seek help, because they start noticing, oh, my child is not talking. So sometimes the first person they even go to is a speech therapist, because they're like, okay, my child is not talking, they're not communicating with other children. So what exactly could be going on? So yeah, the social communication, the language, the repetitive behaviors. Yeah.
We're just trying to look at the signs, and you want to add something so I can go to the comment section as well.
Okay, yeah, because one of the other things in the speech and language you will find, we have something called echolalia, where you find a child is not speaking, but they will repeat everything they hear. Like if you go and say hi, they'll say hi instead of saying, you say come here, they will say come here. They'll just be repeating what it is. Or they'll go to school, be quiet the whole day, come home and repeat everything like a parent that they heard. So that's one of the other sides of that. And then we have something called steaming. Steaming is because, you see, they have issues with sensory integration. That means their senses, their hearing, their visual, is too high. So sometimes you see then they don't have eye contact, or they will not respond when you call them. So most people think they're deaf, but they're not deaf, yes. So when it comes to, you'll find they flap their hands, keep doing this, or rocking in their chairs, or going around in circles and pacing.
I think I've seen this as well.
Yeah, that is because of the sensory, because they hear too loudly. Like you could be talking normal, but then theirs is actually extremely loud. And then that thing with eye contact, you find that their brain processing all those things. And you see, one thing that's special about them, as much as for me, I can focus on you and block out anything else in my vision, they have a 360 view. So you can imagine you're a person trying to focus and your brain can see everything else. So you'll find that lack of concentration with them, and then also not being able to do one thing for so long. Yeah, so that's just
the attention span.
Yes, the attention span also most of the time. There is also hyperactivity. That can be one of the sides. It can be hyper or hypo. Hypo is when it's low, and then hyper is like when they're being all over. We have meltdowns, which very many people confuse as tantrums. But basically, meltdowns is just the frustration of, you can imagine you can talk, you can say what it is you want.
Yes.
So imagine I want that. I have no idea how I'll tell you that I want that. What am I going to do? And you see, they communicate by pointing, taking you like to this one. And then if I want something, they will guide you. So guided communication. So those are some of the things that you will see, because they're trying to make up for their lack of the voice. Because remember, language is different.
Yes.
There is the voice one,
yes.
and some of them actually can sing, but they can't talk. So the brain has different sections that handles different ways of communication. So it's not like they're deaf, or because of their nonverbal, they don't understand, or they're stupid. It's just that that part of the brain that coordinates the speech side of it is either not yet developed or not fully developed. So because you'll find some that they can only say cup, tea, whatever, but they can't do a sentence.
All right.
So those are some of the things that
These are some of the things that you just need to, check through with your child. Maybe you're still yet to get the diagnosis, but I'm glad that you guys are breaking it down so well. And on the comment section, thank you very much. You can also talk to us and ask as many questions as you can. Remember, we are also honoring, the World Health Day, so be open with us as well. Let's be that family that you need at Look Up TV. And I can see here Joyce Kimari is, no, that is, let me see. Yeah, Joyce Kimari saying, I would like to find out from Doc if you have well-equipped public schools that cater for autistic children. Let's start with that. And then secondly, since they are not in a normal setup school, what happens to them after they finish their schooling? Now, number one is, and either of you can answer, I'll start with Doc, and if you have to add, she's saying she'd like to find out if we have well-equipped public schools that cater for autistic children.
We do have schools for, quote-unquote, mentally challenged children. We do have a few. However, the needs for those children, more could be done, right? Because it's a space where a number of them are just mixed, It's children with autism, it's children with severe ADHD, children with cerebral palsy. So it's a mixture of how do you call it, disabilities or children with different disorders.
Yes.
So particularly for autism, none that I know, unless there's one that
But
she probably would know.
would you, from where I sit, I'm feeling like I want to shout out and say, I'd recommend. You know, Sylvia, how do you feel about that status
Oh
quo?
my
Because
God.
if that is exactly what is there, but I don't know, you're a mom and you have your children, you know, and that's
I'm actually having palpitations as you're just talking. Like, I feel so enraged. Actually, the answer is no. There is no well-equipped public school. And that is why, for those who know, my organization last Saturday had the Run for Autism Awareness and Equipping. And what we do through that project is we're trying to integrate autism units to be well equipped. So we are fundraising so that we can equip public schools that have autism. You know, in public schools, you used to hear special unit, you have no idea what that is. And most of us are just like, well, that's where the weird kids are. I was a kid. That's all I knew, because I never used to understand. But you see, the essence of having special schools, special units in a public school is to foster integration and inclusion.
Absolutely.
And that's where how we are doing it, I think we're going wrong. Like she said, you can't throw at me 5 disabilities, give me 2 teachers and expect me to bring the best out of them. That's a no. International standards is 1:5. The public schools I visit is 1:30. And then you're just giving them like, oh, you need that one, you sit and do nothing, you do. One teacher can't. I'm a parent of 2, it drives me up the wall. As much as it's passion, as much as it's a calling, it is not easy and they burn out. So can we just have equity in terms of, you are autistic, you learn by either audio or visual or tactile. I give you tools that will make you be the best version of you by that. You learn, you're more of a talent skilled in music. Focus on my music. You know, there's some who, when we start ABCD, they are not interested. For me, a teacher texted me and like, my son, cookery #1, hairdressing #1. We go to ABCD, he will fall asleep. You know, that is his passion, that is where he's. So we have to go down to like, this child, what are they good at?
Yes.
Okay, CBC is trying to do that. So we are getting, let me say we are getting somewhere. So some parents complain. But for us as special needs kids, we're like, yay, someone is paying attention, because you find that skill-based learning, my child, you asked about integration and going to higher learning. Transition is one of the things that we do not have. Because people start, small ECD, go to secondary school, they all fall off. They all don't even make it to that KCPE. Yes, there is special provisions. Sorry, I sit in KICD committee, and education and all this is just like what drives me. So
you should come back for, you know, the education talk as well, right? Because I'm going to take a short breather, but Joyce, we're still, you know, really going to answer your question. And I want us to come into the stigmatization aspect of it, because that's the reason why, number 1, I don't want to see the doc. Number 2, I'm not exposing that this is going on. So until latter stages, like the adults we've talked about.
Yes.
Number 3, is it a normal conversation, just at a clinic? You know, let's find out more on the big conversation. Keep that comment section active. Shortly after this break, we'll be right back, still honoring the special group of people in the healthcare sector. We'll be right back.
Get a chance to wake up as a tourist as you view Mount Kenya every day by buying a plot of land at Wema Gardens, Naru Moru. At only 400 meters off tarmac, this is the right place to build your dream home, cottages or holiday homes. You can also buy this property to give to your children as a special inheritance. Water and electricity are in the vicinity, while neighbors are already building their homes. These plots are specially ready for you with title deeds scheduled to be out in 6 months. Buy a 50 by 100 plot of land at Wema Gardens for only 399,000 Kenya shillings. You can also pay for your plot through our friendly one-year installments plan.
Want to grow your business? Broadcast your sermon, share birthday wishes, make funeral announcements, produce adverts and documentaries? Then book and advertise with us today by calling us on +254 700 893 542
700 893 542
or email us on sales@look-up.tv.
Welcome to Look Up Guest House, Retreat and Prayer Center. When you first come in, we will be happy to receive you at our reception, then proceed to our cozy and well-equipped accommodation facilities. We aim to provide our guests with a unique, comfortable, and worthwhile experience. Here at Look Up Guest House, we provide our guests with a continuous supply of room amenities. A cool environment for all your retreat activities.
Look Up Guest House, Retreat and Prayer Center. For reservation, contact us on info@lookupguesthouse.org or call us on 0746 788 707.
Are you looking to turn your passion to purpose? Vera Beauty and Fashion College now brings you online classes at the comfort of your home. We are a TVET-approved institution with over 20 years' experience in training competency-based courses in fashion design and creative arts, cosmetology, hairdressing, beauty therapy, interior design in soft furnishings, event decoration and flower arrangement, hospitality and catering, and training of trainers. To enroll, call us today on 0704 577 577 or visit our website at www.verabeautycollege.com. Vera Beauty and Fashion College, a center of excellence.
Help me identify a beautiful woman. I never came across one till I got to Vera.
The future of money is simple, like unlocking possibilities with a smile and having the world in the palm of your hand. It's the ability to touch many lives at the same time and turn your dreams into reality. It's forgetting and still remembering. Simple is having everything that you love in one place. From the ticket to your next meal, to your ticket to the next holiday. It's an easy way to ask for a boost when you're low. And keeping track of everything on the go. The future of money is simple, and it's here. Download the new M-Pesa app today.
And thank you very much for staying tuned. This is still the big conversation on hashtags The Morning Drift. Just reminding you that it is the World Health Day. However, here we have decided to take another step and look at a different angle to it. And of course, joining me is Miss Africa, Sylvia. Of course, a mother of two autistic children, championing, and she's all blue. Thank you very much for all you do. Daktari Linda. Yes. Karibu sana. and you're a psychiatrist, also really, championing for mental health. Thank you very much for creating time. And there are a few feedback that I had to read that would, guide us as we continue the conversation. Joyce, I hope you got your first answer, and also still asking, does Kenya have support groups for parents with autistic children? I have friends with autistic children, and it's not easy at all, especially when some of them are crying and you don't know what they want. So maybe you want to answer that real quick.
Yes, support groups are there. We have regional ones like parents from Nakuru, parents in Nairobi. We have the ones who are more spiritual. Those are now WhatsApp. Then we have some on Facebook, like on my, or where you discuss issues. Those ones are there, they're available. I know we have, and this speaks for special needs persons, it's a group for caregivers. You can ask a question, and we are learning through experience. This is what I did, this is what I tried. Like I said, there is no roadmap to this thing. We don't know. So I can learn from what you did or so, but we also prefer you have professional assistance.
All right.
So just don't depend on what I did and it worked, because no child is the same.
And
So it would be just that emotional, it will come to pass. I took time. And then that crying is just frustration. Just try be accommodative. Create your own language of, like, remember what I said, if they're nonverbal, you show them photos so they learn to know how to ask for something.
Yes.
So you tell them cup, you show them. Then, or when they want something, you're like, cup, then you give them.
Okay.
So you're prompting communication, and it will make their life easier from frustration.
All right, thank you for, of course, acknowledging that there is a lot of emotional support, and do not compare your children either way. As much as there's a support group, every parent there is dealing with a different situation. All right, thank you very much, Joyce, for that question, and I hope that is satisfactory. She's also asking Doc, is there a connection between ADHD and autism?
Yes, very comorbid. Autism is very comorbid, but that I just mean coexists with other disorders.
Yes.
Sorry. Yes, so as she mentioned, like, I don't know, it's your first baby?
Both of them.
Yes. Epilepsy is very common. ADHD is also very, very common with autistic children. For those who don't know what ADHD is, basically attention deficit hyperactive disorder. So these are kids who are extremely hyperactive. Some are just inattentive, but some have both. So yes, they're very, and the other one is the intellectual disability. Those are very common coexisting disorders with autism.
All right. Thank you very much for making that clarity. I also want to hear the many other common, disorders, and we haven't touched on mashinani. We hear a lot. I don't know if they're reported. The cerebral palsy. I don't know what you have to say about that, even though we are just talking about this
The
neurodevelopmental.
neurodiverse.
Yes.
Yeah. We've seen an increase in cerebral palsy. So the debate is usually, is it because of awareness, or is it that the numbers are high? So for autism, we are currently at 1:54. Cerebral palsy, I'm not sure. But you see more parents are coming out that I have this, I need support in this. And then it's more on the media. But you also find that during pregnancy, our environment, the foods we eat will also affect. For those who give birth at home, if you get complications, of course it's going to affect your child. And also we've had cases where doctors have neglected, a parent, let them labor for too long, during CS and stuff like that. And all those things are things that can cause cerebral palsy. And also we have to watch, like, yes, life is stressful, but remember when you're carrying this child, anything you do will affect them.
Yes.
Those who drink or take drugs when pregnant, also that's another cause of it. So we just have to watch out. Because remember, when you're talking about neurodevelopmental, that's you as a parent, you're carrying this child. Their development is also relying on your well-being.
Yes.
So yeah, if you look at all these factors that we have around, we should be able to at least do better as parents.
You've mentioned the role of parents.
Yes.
And unlike the genetic makeup or any other thing, there's just being careless.
Yes.
You've also mentioned the health practitioners.
Yes.
And I'll come to Doc again shortly. But when you talk about doctors being careless, today it's the World Health Day, so I want to bring it out very clearly. At what point do we see the carelessness? You've talked about laboring too much or too long, because I know docs are watching as well. So Yeah, we just need to make
But
things better.
let me put a disclaimer, I am not a doctor,
No,
but
she's not.
as a parent,
Yes.
we have support groups. And I mean, most of these support groups, because of advocating for what it is that they're going through. So I mean, cerebral palsy, Adhd, Down syndrome, all this, and they're my friends. Because as the organization Andy Speaks, we're bringing them together as the neurodiverse community to bring out what challenges they go through. So the horror stories you hear is, let's say you are inducted for too long. Mine, I was inducted thrice, all of them were failed. Like by the second attempt, you know, US doesn't allow even more than 2 maximum, you see. So those are some of the things that you look at. We've had that neglect of the pushing and the delivering and the suction, all those things you have to be very, very careful about, you know. And then when the child does not, what do we call it? Like when they have difficulty, what do you call it? That first crying point. How they handle at that, yes, at that point. And those are some of the things that you see. You will be, when during diagnosis you'll be asked, did your child cry? Were they in HDU or in the incubator, and for how long? How did they react to XYZ? And also now I know, like, if you heavily take alcohol and hard drugs, of course you'll affect the development. And remember, the thing with cerebral palsy, 5 types of cerebral palsy, yeah? And it's all just development of the brain, but which part of your brain is affected? So you will find someone saying, I have mild CP, where the child can at least talk. There are those ones who fully depend. They are not toilet trained. They can't eat. They can't chew. You have to feed them liquids. You know, we have this entire spectrum. There are those who, depending on the severity of the brain damage and which area is affected, you find those ones that it's only the hand that got affected, those ones who cannot move at all.
Paralysis?
Would you call it paralysis, really? No, it's just more, the motor skills are affected. Motor skills is generally movement of the body.
All right.
Yeah. So there is a specific part of the brain that is responsible for that. So if that gets affected, and how severe, then you'll find those who, with therapy, will be able to walk. There are those who will never be able to walk. Then you find there can be malnutrition, you know, because you'll find CP kids are relatively very small, and some are big. So it just depends on which part of your brain actually got affected.
I have felt a bit of hope when she said with therapy.
Yes.
You get to do that with therapy and with treatment. Let's talk about that aspect. It's not the end of the world. You're managing.
Yeah.
How do you manage, you know, autism, for example, and then maybe if you want to touch on any others, but let's just talk about management of these disorders, because it's possible.
Yeah, okay, so allow me to just take you a bit back.
That's okay.
Part of the diagnosis, as we mentioned, was getting the whether the child meets the criteria, do they fulfill the criteria, and even if they fulfill the criteria, what's the severity of the illness that they have? Is it mild, is it severe? Now, because now that will now plan. Now that's what we'll use now to plan and follow through management. So part of this is the part of the diagnosis is also to make sure the child does not have any hearing issues. So you may send them to for a hearing test. You can send them to a speech therapist as well, just to make sure that that is in order. Then now moving forward, we'll also incorporate speech therapist. Okay, again, it depends on what the child is ailing from mostly.
Yes.
What needs to be worked on, what can be worked on, what can't really be worked on. So it's about now, which areas are we trying to improve and what are we trying to improve in those areas. And that's usually very important also to address with the parents, so that you don't raise expectations also, because we want to know from this assessment how far, of course, it's not cast on stone that you see. This is the match they'll go. Some kids miraculously surpass, but generally, what is the expectation? What is our view moving forward? Where do we expect this therapy to help us? Where do we
So you're
expect
seeing a lot of, you know, attentiveness and cooperation from caregivers in terms of management. They really, and you talked about being present and having to know where they are at and always checking them. And I want to talk about, you know, the fact that you're a psychiatrist. Somebody asked off air who's a psychologist and who's a psychiatrist. You talked about branding because you took into Mathare Hospital to see a psychiatrist when Asema Umechizi. That was what you said yesterday. So the stigma around it. You know, you mentioned as a parent the kind of stigma that, you know, and I want to hear from Doc here as well. If, you know, the health sector, the Ministry of Health is also watching, is instead of doing away with the stigma, indirectly upholding the stigmatization around this particular, you know, aspect.
Just like any, most mental health disorders, stigma is one of our biggest enemy for patients to seek help. It's usually a very big determining factor for who comes to hospital, who doesn't come to hospital. So there's stigma within the community, but I'll also say this, but there's also stigma in the health sector, such that there are facilities where you take the child and they'd be like,
not our business.
Peleka kule mental. You know, like they don't even want to know, probably this child has a cough, you know, but they're like, patient with autism, they don't even want to understand what is going on. So there's a stigma within the community, and then there's also a stigma within the
Before I come to Sylvia, I want to, because I know she has points around that, I want to just go into recommendations. You being a psychiatrist, you get firsthand, you know, when they're stigmatized, you're stigmatized. Because like you said, it's a cough, it's a headache. You're not supposed to, I don't know if I'm getting it right, but what are the recommendations? You can talk to your fellow doctors, or it's a health day. What should be done differently?
This is one of them. Speaking about it, creating awareness. Again, as you said at the beginning of the show, it's usually something that's swept under the rug. We want to focus more attention on things that are more acceptable. You know, hypertension, diabetes, cancer, you know, things that are a bit more acceptable, quote unquote, in the community. So just talking about it, creating more awareness, so within the community and also within our doctor circles, which we're also trying to do. So having more awareness programs will go a very long way. The other thing is, as far as it is in the country currently, we only have 2 child psychiatrists who are both located in Kenyatta. Last I checked. However, I think they do help with other facilities, but they're the same ones who are everywhere. You know, we have very few child psychologists as well. So, for example, I work in Mashinani.
And the Mashinani question is pending here. So it's going to come to you shortly.
I work in Mashinani. So now a parent that comes from, I work in Isiolo, but we see patients also from Samburu, Marsabit, Moyale. So a patient has come all the way from Marsabit. Then you are telling them, I cannot assist you. You have to go to Kenyatta.
In Nairobi?
Yes. Kenyatta National Hospital here in Nairobi. So that is them to book a whole day of travel, to book an accommodation for the night. They'll come to hospital so that they can get help. The queue as well. So there's how we try to help them, also trying to liaise with Kenyatta, trying also maybe to give them the match that we can at our level down there in the facility. But of course, we usually advise them to come, at least get the full proper diagnosis, treatment, care plan, and then we're able to follow through even at our level and see what we can do.
Andy, I know you're with me in this because when she mentioned we have to send you to Kenya, I'm looking at the budget allocation today.
Thank you.
I am looking at the budget allocation today. Because I don't know what you have to say. Maybe there's going to be change. I don't think you have to take a flight, which you cannot afford as well, or be on the road in that condition.
Imagine, remember we said an autistic child's routine. So you expose them to a whole day. You take them for diagnosis. Will you get the right diagnosis? And then you find a doctor who will not listen to the parent and they just want to judge that child from that. All that trauma of, first you've uprooted me from where my usual environment. It's a new environment. Autistic kids very hard time adjusting to new environment. It will take so long. Then you take me to this hospital. We all know the state of how our national hospital is like. Everyone is going there. The waiting lines. For me, I went when I was, hey, me, I've seen this life. When I used to go, I've been through it. I tell you, you go there at 6:30. Your appointment is at 9, but I'm being seen at like 1. This child has driven me crazy. I didn't carry enough food, you know, and that hyperactivity. And once they're done with the place, they're done. Let's go back to stigma before I forget. That is like, as a parent, you just have to wear a shield over your heart because it will be your daily, everywhere you go, stigma will be part of your life. From kids to parents to professionals, everyone. You know, the disability, I know you were asking about, if you find the definition of disability is the fact that you cannot operate normally in the environment. So that autism and all these other comorbid conditions are disabilities. As much as sometimes we say, oh, it's not disability, the fact is, my fellow parents, it is a disability because that child cannot function okay in the environment that we currently have. Some will say that the environment contributes, it either heightens it depending on the accommodations we put in place, right? Okay. And then when it looks at stigma, how do we bring it out? As parents, you can see that's a special needs child. I saw yesterday there was a webinar and the parent said the other children are willing to play with the child, but the parent is pulling their child away. So you are bringing that mental state of this child. The child is not being judgmental, but your judgment is now being handed down. How many of us do that? If you look at the statistics, it says 1:20 in disability. That means let's not look at the 20, you know, and that's only 1. Let's see, this one child has the opportunity to teach 19 kids about inclusion. Let's turn the tables. Why do we have to make our special needs kids be the ones adjusting? Why can't we accommodate them? It's simple basics. If we start early, and this is what I usually challenge when I sit in the KICD academic committee, I say, in our curriculum, let's include those stories. Let it be our daily routine about inclusion. As you're saying, people are reading about these stories. Let's have one disability story in there. Because if you bring up a child knowing that there are people who are not like us, the next time they meet one, they will not look at them like, oh my God, this is a phenomenon, all right? It will be like, okay, this is what we were being taught about. And they'll be able to embrace, integrate, and include them in everything that they do. And when they become leaders, we will not be going through this thing of a law is passed, policy matters. Then us special needs parents have to carry our placards, oh, we are forgotten. We don't have to always be the forgotten. Just include us from the point of everything that you do. And in everything that you do, cut across, is it going to accommodate everyone? And that's how we will end stigma from when our kids are growing up, and awareness. Ignorance is no defense. All right. Ignorance is no defense. And one of the things that for our nonverbal, you can't talk to my child, they don't respond. Don't brand them. He's 12, he can't talk. Ask me. Don't start giving me words like, sasa mtoto mkubwa hawezi ongea. You know, it crushes someone's spirit so hard. Sometimes you have no energy to fight. Even service providers, you know, if I'm coming to you as a like she said, I've come to you, you see he's hyper, don't send me to another department. I'm the parent, I know why I came to you. All right. Yeah? All so right. Just be accommodative and understand. Sorry, this topic really no, we gets to a certain point in my heart that you just, it's just not fair. All right. If you ask me, it is not. Because none of us, when we were pregnant and giving birth, we all expected perfect children. And it's not like a parcel I can return to sender and tell God that, dude, me, I can't deal with this. I have to embrace it. So just make my life a bit easier by being kind.
Amazing, and I like that one of our viewers is just texting in saying, I've seen a lot of improvement in my friend's child after being included in everything we do. Just what you are saying, that it is okay to have them play with other children, you know, talk to other children about the condition. it's actually better than stigmatizing. And you said, parents, don't pull your child away.
Yes.
Yeah?
It's not contagious anyway, so why are you pulling them away? You
No,
know?
it's not contagious.
It is not.
Yeah, and of course, here, any special diet for autistic children? I've seen there's normally a problem with the teeth. I'm not sure if these are isolated cases. Someone is saying she's apologizing, but I think it's okay to ask that, Daktari.
Mostly if you notice your child is being very hyper, that's where we'd probably want to look at what foods cause them to behave in that way. So for a lot of them, it's sugar.
Ah, the sugar.
Yes.
For all kids,
The proper. Now
for
theirs
theirs,
is times 10.
yeah, it's way more heightened. So that is one thing you'd want to watch out and reduce. And of course, just like every other child, you don't want them to have proper nutrition. One thing with some autistic children, not all of them anyway, is they may tend to refuse some foods because some textures of foods, as she said, their sensations are quite heightened. So some food tastes or textures do not go quite well with them. Not because they are allergic or they will not, but they just
can't take it.
They just can't stand it. It's a very weird taste for them.
I'm looking at the kienyeji that is very, how do you call it?
The mashed thing.
Yeah, I think I have a case study online that I saw actually reject. She doesn't, it's Nigerian. You know, fufu, she wouldn't touch it.
Yeah. My son loves saying ice cream. Yesterday he was like, he's seeing others eating ice cream. He's like, ice cream. Then the minute you drink it, he's like, yuck. He's not even tasting it. And the good thing is like, he doesn't like very sugary stuff. So I always say, thank God. But processed food is the other thing you have to cut down on. There's some, but we always advise seeking nutritionist interjection so that, you see, one thing everyone will tell you, cut off gluten. You know, this is wheat product. Some of them will take you, do away with milk. But then you have to remember the teeth story. You have to remember how to supplement that calcium. Because most go with Google, because that's one of the things you will find, but then you're not seeking supplementary options for that. Then you find, like, if you have a child who's epileptic and you're on medication such like epilepsy, they tend to eat away on the teeth. So also do a lot of dental checks and brush their teeth. But the challenge, again, sensory. Teeth brushing, there are days they don't want to hear about it. So you just have to make some of these activities fun and supervise it so they do it very well.
And that is very satisfactory. And of course, she's saying including punishment. You know, you do everything. She's saying changes in my friend's child after being included in everything. We even do punishment.
No, it's just, I understand what it means. Because sometimes, because they're special kids, you tend to give them room to misbehave. All right? So they need to understand it is not, yes, you're overcompensated, then now you're nurturing. Remember behavior, they are very good at picking the patterns that we said. If every day I know this is kept here, then I learn, that's where. So if every time I cry, you're like, oh, baby, so they know if I need something, I'll be crying. So you're feeding that behavior instead of correcting it in the terms of like, you're crying. Why are you crying? What do you need? Show me what you need, I give it to you. You're teaching language instead of nurturing now this other ghostly behavior. But then also the behaviors you have to also pay attention. It could be a discomfort they cannot communicate. That's why they're behaving that way. So we also talk about when they do something well, like applaud them, then they know, okay, that is correct, you know. So there is very many ways of communicating and behavior, but then don't overdo it, because now they'll know, for me to get that, I need to do something good. So you have to really be careful of how you craft it.
All right. Yeah. Our time has run out, but yes.
Just to add, I think this on the treatment bit. So behavioral therapy is usually very, 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 very important. You can't do away with it. Another thing is the occupational therapy. See how much they can do. And that will come during probably the diagnosis stage. How far, because when they're also having a diagnosis, is also to also diagnose the IQ, as we also mentioned, so that you're able to know this is a child who can maybe do this stuff by themselves. This is a child who needs me fully, completely. So a child like that, you know, it'd be, I don't know what you'd be punishing, because they're really, 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 you know. So, so it's also the occupational therapy, speech therapy. We have the behavioral therapy. Sometimes with the so-called tantrums, if they are quite persistent, you may need to see a specialist, because sometimes
you know, a parent in Machinane doesn't know which specialist you're saying.
a child psychiatrist.
They go to a pediatrician, they're told go to a psychiatrist. They go to a psychiatrist, you're told now.
I think it's a field that cuts across either whether you see a child psychiatrist or whether you see a developmental pediatrician, neurodevelopmental pediatrician. Either should be able to assist you. So it's one that cuts across.
But then you see, you also, for the therapies, you have to know which one comes first. If you start with speech and they're not settled, you're wasting time. So you have to also be advised what starts, because I know that's what I went through. I was like, I want speech, I want OT now. And I'm like, you can't do speech. You have to start with the occupational therapy, because that's now calms them, their sensory, everything. Then now when they're doing speech, you're able, because speech requires a lot of like doing this, do that, you know, your muscles and etc. So you have to really be guided through it.
Now I want to give us only 3 minutes to wrap up, but we're going to be answering, you know, Fred. Fred, I haven't ignored your comment on blood pressure, or is it pressure? Is he saying our guests, in fact, he said our beloved guests, he was just actually bribing us through that. Is there normally medicine that heals permanently pressure or heals pressure permanently? And what are the causes of pressure? We're coming to that. We're going to respond briefly. But I wanted to now challenge you. You're Miss Africa, and we are leading in, you know, stereotyping and stigmatizing aspects that are neurological. You say, oh, hide your child, they're mentally ill, or do not expose your child, they're not born normally. And I want to hear your closing remarks on this World Health Day, calling out to not just the entire Africa, but even the family units in this country today, and even the health sector, on normalizing these conversations and stepping up.
Okay, first of all, like I said, stigma starts at home. For you as a family, the first step, we know we always have denial, depression, acceptance, then we do something. I want to challenge the parents who think something is wrong. Step out. As the founder of Adhd Speaks, what I did is I brought out my kids. This is how our life is, so that others can see you're not alone, you're not stigmatized. Your child can be normal. Just embrace them for who they are, not the child you expected. That's for the family unit. In Africa, as Andy speaks, like for World Autism Awareness Day, we usually do the ride in Kenya. This year, we've taken it to South Africa, Ethiopia, Ghana, and Nigeria. So that, and when I go there, we all have the same issues. I sat with parents in Ethiopia. The same stigma we get here, the reasons why they hide their kids, is the same everywhere. So let's start. We're all sharing the same issues. Let's all stand up. Comes to the health segment, remember, disability has moved from being a health issue to a rights issue. So it is their human rights to be included, loved, embraced, and everything that any regular person will get. They are entitled to the same education, health, and as much I'd like to challenge the Ministry of Health, when you're talking about universal, I'd like to challenge NHIF, why my child I cannot pay for therapy using my NHIF card unless I work for government. What equality are we talking about, and equity? I want to pay for service that befits my child, not what you think is this we can tick, this we cannot tick, oh, this is what, but meet me at my point of need.
All right, and that came out, I don't want to dilute that. She actually challenged certain, you know, bodies, and that is another thing about inclusion, and that you have really touched on. Thank you very much for what you do, and for your strength. You're a motivation, inspiration to so many other parents this morning. Dr. Linda, you know, being a psychiatrist in the health sector also, I don't think it's easy. Like you said, you just want to talk more to the, you know, your medical fraternity on this aspect in your own words, even as we close and mark this Health Day. The camera is right there.
Was there to answer the hypertension question?
Oh yeah, you can, you can actually start with that and then conclude with your closing.
Okay, yeah. To
Fred, you're very lucky.
To Fred, no, there's no permanent cure for hypertension, but it would be important just to see your health provider, just to understand the options of medication that you have. Of course, there's the dietary and the lifestyle modification that you have to do. Unfortunately, there's no shortcut, but to just, you know, medication and your lifestyle modification. But please do seek help first. This is just advice, it's not a treatment. Disclaimer. Yes, so just to wrap up, autism has been one of those and mostly a lot of neurodevelopmental issues have been those conversations no one wants to have. You want to treat quote unquote normal people. No one wants, but the problem is we do not understand, we don't even bother to want to understand, to know what exactly is autism, why do they behave like this, why is this child hyperactive. So just also being aware of what those are. Go read more about it, don't just have that sort of stigma because of ignorance. So yes, I think we should all be a bit more receptive to children with disabilities, to adults with disabilities, and just know it's not a choice that they decided, me, I'm going to be autistic. I don't feel like this life, I want to be okay, let me choose to be autistic. It's not something they chose, so it's just be kind to them, be receptive to them, and just understand that they're just as human as you are.
Thank you very much, Dr. Linda, who is our psychiatrist on set, and we also have the mental health advocate and Miss Africa, Sylvia. I almost called you Dr. Sylvia for a second there. I had an awesome time with you guys. It is marking the day, and it's a special, aspect for me, because the greatest of the things in our blood and in our environment and in ourselves is health.
Yes.
Otherwise, why would we even be here laughing? So we're really glad that you're all healthy. Please stay healthier and come back for the next segments and more. And that is it for the big conversation right here on The Morning Drift. I'm still coming in. The conversation continues. It seems like it's about that time that we normalize the therapy, especially parents like Sylvia. I'm looking at, having these conversations. It's okay not to be okay. And when you need help, like she said in the support groups, get talking to somebody. I'm having a victim of a road accident coming on set shortly with his therapist on set, just talking about the mental harmony. How are you doing today? Let me know in the next segment. We'll be right back.
The future of money is simple, like unlocking possibilities with a smile. And having the world in the palm of your hand. It's the ability to touch many lives at the same time and turn your dreams into reality. It's forgetting and still remembering. Simple is having everything that you love in one place. From the ticket to your next meal, to your ticket to the next holiday.